Okay, so I think this is recording, so I'm going to go share screen. And we're going to go reproductive. So hopefully that's coming up. Let's see. Looks like we're recording. So this reproductive 2. So this is going to focus primarily on the female reproductive system. So this is across, a cut of the ovary, kind of in a frontal plane, I guess. And what it's showing you are primary, secondary, tertiary follicles. This is a tertiary or a Graphian or a mature follicle. That's an oocyte. And we'll go into a little bit of this. The only way the artist had to draw it was draw it in a circle like this. This stuff kind of takes place pretty much in one spot. So in other words, the secondary follicles, the primaries will, some of those will become secondaries, and then one of those secondaries will end up being a tertiary follicle, and this is the one that ovulates. So these cells that are around here, these are called thecal cells. We'll get to that later. They end up being this structure, which is the corpus luteum. So this would be here. It's just the only way they had to draw it was to draw it over here. And so that structure that's left behind, that's made of what these cells, that becomes the corpus luteum. Corpus means body, luteum means yellow, and that puts out 2 hormones. We'll talk about that later, estrogen and progesterone, to prepare the body for pregnancy. If pregnancy doesn't occur, this just kind of starts going away. It gets little like this. The only place they had to draw it was over here, though. Understand this is all happening in the same place. So it's just going to just go away and just become a scar, basically, if pregnancy does not occur. So don't worry, we'll go into all that. I'm not going to ask you about first polar bodies, second polar bodies, all that. Just know when all is said and done, the ovum is haploid. Remember haploid versus diploid? So by puberty, there are about 400,000 oocytes total. That's the way it's pronounced in the U.S. If you're from Canada, they pronounce it oocyte. So anyway, during the ovarian cycle, the oocyte matures. Only about 500 will mature and ovulate during a female's lifetime. Okay. The follicle cells, around that follicle there, part of that follicle, provide nutrients to the oocyte. So the oocytes plus those cells, that's called the follicle. So that's the mature follicle. Okay. So the development of oocytes, occurs within those follicles. So I'm not going to get too hung up in this, but I mentioned thecal cells. It's a little more complicated than this, but let's just say they help produce estrogens, right? A few primary follicles develop into secondary, and then of those, so now you got thecal cells, and they're making more and more estrogen during this time of the cycle. And then one of those will usually contain a single secondary follicle that's destined for further development, and so it will become this guy. And so this is the mature follicle, or the tertiary follicle, or you can call it old school Graphian follicle. Oh, that should have a L right there. So ovulation, that's when the oocyte is released from the ovary into the, I don't call them uterine tubes, I still call them fallopian tubes. We have enough stuff that starts with a U, right? So fallopian is fine. Formation of the corpus luteum, we talked about that, remember, yellow body. In the remaining follicle cells, for the corpus luteum will produce estrogen and progesterone. So if pregnancy doesn't occur, then the corpus luteum will degrade into basically like a little scar tissue. And then boop, you're going to start the whole new cycle over again. So a perfect cycle is generally 28 days. It's not always perfect in each and every female, though. Sometimes it's shorter, sometimes it's longer. It's the exact same drawing, so hopefully it makes a little more sense now. Okay. Um, so the uterine cycle. So we're talking about what happens in the uterus. What during these 28 days. So this kind of old school minis. I say menstrual phase, proliferative phase. So menstrual phase would be like day 0 or 1, however you want to look at it, through day, I don't know, 7 maybe at the or so. And the proliferative is generally from 7 to 14, and the secretory phase is generally from 14 to 28. That would be in a perfect 28-day cycle. So during the menses or menstrual phase, the arteries constrict, reducing blood flow to the endometrium, and then that will slough off and be expelled. So the tissue of the endometrium and the blood from the ruptured vessels, and that's in the lumen of the uterus, and then that makes its way out the vagina there. So let's look at these phases here. This is a great chart, by the way. I have this with no writing on it, so I can do things like I can put a bracket here, and I go, what phase is that? That's the menstrual or menses. Then what phase is this? That's the proliferative phase of the uterus. What phase is this? The secretory phase. So secretory phase, proliferative phase, and the menstrual phase. So I don't really go the ovary. If you're talking about the ovarian cycle, it's easy. It's just pre-ovulatory, ovulation, post-ovulatory. So what's cool about this chart or this drawing is that it's showing the uterus during those 28 days. It's showing what's happening on the inside of the uterus. It's showing you what's happening with the follicles. It's showing you what happens to the oocyte on day 14, ovulation. Then it's showing you the corpus luteum. And then if you remember, these are thecal cells. Remember these thecal cells, they help in the production of estrogen. So look what happens to your estrogen. It's going up during this phase because they're helping produce that. FSH and LH, remember these two anterior pituitary hormones? Follicle stimulating hormone and luteinizing hormone. Okay. Follicle stimulating is going to stimulate these follicles, right? And so, it's up a little bit here because it's stimulating the follicles. As you're getting more and more thecal cells, you're getting more and more estrogen. Then you're going to have a spike of LH right before day 14, okay? And that's going to induce ovulation. So, then you've got the corpus luteum, which is left behind, right? That's making estrogen and progesterone. So look what's happening to those levels going back up here, okay? And are going up and then going back up, okay? And then now, if pregnancy doesn't occur, then both of these levels start going down, and then the whole cycle is going to repeat again after 28 days. So hopefully that makes sense. It's anatomy. Don't overthink it. I can just go, what hormone from the anterior pituitary spikes right before day 14 and causes ovulation? You go LH. It's luteinizing hormone, but if you just say LH on the test, I'm going to give it to you. What stimulates the follicles, right, to start, doing their thing, getting more and more thecal cells, stuff like that. Follicle stimulating hormone. Okay. What is this structure? You go corpus luteum. What two hormones does that make? Estrogens and progesterone. Okay. Then I could ask you, what phase is that? What phase, uterine phase is that? What phase is that? Okay. Or I could say, on a perfect 28-day cycle, when does ovulation occur? You would go day 14. Now understand, that could be, it's different for different females, it just depends on what day of the month they start their cycle, right? And so it is 14 days after they start their period, right? So, of course, not everybody's starting their period on the same day, right? So, it can be different for pretty much everyone, or so it's 14 days after the initial bleeding. Okay, as a general rule, in a perfect cycle. Now, can you ovulate before or after day 14? Yeah, it depends on your cycle. So it's not a perfect system, but we're going to talk like it is. And we're going to say, in a perfect 28-day cycle, when does ovulation occur? You would go day 14, right? So, you just have to mark on the calendar, when did the bleeding first occur, and then count 14 days. And then that would be when ovulation should occur. Okay, so is everybody clear on that? Okay. All right, so let's back up. We talked about the thecal cells helping release estrogen, stimulates the growth of the uterus, I should say uterus, the endometrium in the uterus. It's written poorly there. Maintains accessory organs and glands of the reproductive tract, influences secondary sexual characteristics in the female. So we're talking about estrogen here. So FSH and LH we talked about. Prolactin, that's to do with milk production. Follicle stimulating hormone supports oocyte maturation, stimulates the follicle cells to release estrogen. Luteinizing hormone stimulates the ovulation and formation of the corpus luteum, right? And then prolactin stimulates production of breast milk. Okay, so that's just show. We're not going to do these on the microscope on this test, but it's just showing you how different the endometrium looks of the uterus during menstruation versus the proliferative phase. Remember 7 through 14 versus the secretory phase. Totally different appearance. So we're not going to do that to you on the microscopes because it's just so different, right? But I could ask you layers on something like this. I go, what layer is this? You'll go endometrium. What layer is this? Myometrium. What layer is the outside? You would go perimetrium. Okay, there's the cervix down there, right? The vagina would be down here. So that cervix is where they do a pap smear to make sure you don't have cervical cancer. This up here, by the way, is just called a fundus. Remember on the stomach you had a fundus, generic word. All right, so we talked about the 3 phases. Everybody's cool with that? Let's make sure we didn't skip anything. Yep. All right, we're not going to go into this. This is kind of FYI, but I just wanted to point out that a vasectomy and tubal, ligations, getting your tubes tied, they're not 100%, right? They're not 100%. Same thing here. I'm not going to go into sexually transmitted diseases. You'll get that in other courses. I just will make a little brief mention. The latex condoms, you should probably just put a fairly effective barrier against HIV, viruses, and bacteria, that are fluid borne. It's not 100%, right? It's not 100%. Things can go wrong. It can leak or, have a little hole or whatever. So it's not 100%. It's not 100% effective barrier. Some STIs like herpes, the human papilloma virus, that's skin to skin contact, so like that wart virus, there's a lot of different human papilloma viruses, and some of those are implicated in cervical cancer, oral cancer, anal cancer, esophageal cancer. So do your own research on that, but condom is not going to be an effective barrier to those as a general rule. Now, if fertilization does occur, then it happens here. So they drew this kind of poorly. These are kind of down closer to the ovary. These little fingers are called fimbriae. It's on another slide, right? So you're going to ovulate. It's still haploid here, but here comes the haploid sperm. And then when one of those gets together with the egg, then it's diploid. And then this is going to get swept down this direction, and then it will implant, hopefully, into the uterus properly. And then a placenta will develop. Okay? So don't confuse this anatomy. Don't confuse your point name stuff. That's the ovarian ligament. This is the fallopian tube, right? Now, if it got stuck and implanted in the tube, that's a tubal pregnancy. That's a very dangerous situation. That's an ectopic pregnancy. It can be in the wrong place. And they've actually had cases of like this egg being fertilized and it doesn't get in here somehow, and it ends up implanting on the outside of the uterus. It's still an ectopic pregnancy. There was some celebrity that had that happen and, developed a placenta normally, but of course they had to do a C-section. So, and everything worked out fine. I can't remember who it was. They've had this go to the wrong place a few times and form placentas somewhere, maybe 4 or 5 times in medical history that I know of. So that those are all considered ectopic in the wrong place. We're not going to go into intrauterine devices. This is just showing you the placenta developing. I could go, true or false, the mom's blood and the baby's blood mixed together at the placenta. You would go false, right? Because look at the baby side, the capillaries are completely intact. Right now, things break down on the mom side, but there's no blood transfer. There's only nutrients, maybe some antibodies, some oxygen, things like that. There's no red blood cells going across because, that could be a disaster. What if they're different blood types? So unless something's wrong, there's no transfer of blood from the mom to the baby. They're totally separate. And then the baby's making oxygen and carbon dioxide, right? And so that has to go back across and get picked up by mom's system. So no direct connection. So, all right. That's just showing you how everything's placed, right? How everything's situated in there. And it's just showing you right before birth, the baby tends to drop, they call it, and turn, and hopefully they'll come out in this position here. If they're backwards, they call that breech, right? So should come out this way, okay? You can see what happens to the small intestines up here. And your mom usually complains of heartburn because this gets pushed up. Also complains about having to go to the bathroom a lot because the bladder's being pressed upon here. Okay. And then there goes the placenta afterwards. Okay. And then now we're just kind of focusing back on the male for a little bit. But we talked about most of this. Just make sure you can pick out the pieces and parts like the vas deferens, seminal gland, prostate gland, ejaculatory duct, prostatic urethra, bulbourethral gland. Don't forget you have 2 of these. You have 2 of these seminal glands, but you only have 1 prostate. And then you got the spongy or penile urethra. Then you got corpora cavernosa and the corpus spongiosum. You got the glans penis. And you got the foreskin, also known as the prepuce. Don't forget testes and epididymis. And then the scrotum is the skin around here. All right, don't forget the bladder right here. So in the male, the urethra, parts of it anyway, are it's in the reproductive system technically, and it's also in the urinary system because it's a shared passageway, right there, okay? We talked about this last time. We talked about the spermatic cord. It's got the cremaster muscle around all of this. And that says those internal oblique, part of the internal oblique muscle that got drugged down, and that helps raise and lower the testes for temperature control. This is showing you the blood vessels and the vas deferens. Same thing. Make sure you know seminiferous tubule. I'm not going to hit you with reed testes on this test, or the straight tubules, or the efferent ducts, but I could go epididymis, vas deferens. That's fair game. Tunica albuginea, maybe. That's the connective tissue on the outside here. Okay. Out, I would point at tunica vaginalis. That's that serous membrane that gets drugged down. It's, for lubrication here. But anyway, it's the back of the bladder on a male. That's a male because it's got prostate gland. Got a prostate gland. You got seminal glands here. You got bulbourethral here. And then there's your ureters. This is on the posterior, right? You can see how your vas deferens is looping this way. Okay. There's your corpora cavernosa, corpus spongiosum, and then there's your urethra. I have a slide. I'll put that up for you on a review of a real crosscut, and you can see pretty much all of this. There's prepuce that we talked about. There's a glans. Don't put a D on it. Glans, right? There's your urethral, external urethral meatus, a little opening there. Did all that. Then on the female. So make sure you can point out ovary, fimbriae, fallopian tube, 3 layers of your uterus, perimetrium, myometrium, endometrium. There's your cervix, the little area around it they call fornix. There's your bladder, right? There's your urethra. Don't confuse that with vagina, right? There's the mons pubis, that little fat pad. There's a clitoris or clitoris. That's the kind of the analogous. It's kind of analogous to the glans penis. That's where all the nerve endings are. Can't really see the labia minora and majora here too well. Here you can. Labia just means lip, so that's minora, majora. There's a clitoris from a different view. There's a urethral opening. See how it's totally separate from vagina, because it's not part of the reproductive system at all in the female. The vaginal entrance, and then this is a torn hymen. The hymen is in a virginal female. It doesn't go all the way across. There's still a little opening there. It's a diaphragmatic barrier. Did all that. That's just showing you how everything's positioned. And then this is kind of nice because it's got the ovarian ligament. It's got the fallopian tube. I'm probably not going to hit you with ampulla and infundibulum. That's just these areas in the tube. Fimbriae, those are nice there though. And then here, it's got the ovarian ligament. And then this is nice because I can do broad ligament on this. It's called a broad. There's also suspensory ligaments. See them there that hang this from the body wall. But since you can't see them too good here, I doubt I would point at it. Ovarian ligament's fine. Right? Broad ligaments are fine. Cervix, that's pretty good view there. Okay. And there's your 3 layers. That's pretty nice. Did all that. Oh, I forgot I had this laminate. I just do the 4 things. Nipple, areola is the pigmented area here. Then don't forget mammary glands and lactiferous ducts. So that's only 4 things I can point at. Lactiferous ducts, mammary glands, areola, or nipple. This is great slide. So this is seminiferous tubules. They're cut across, right? Here's where all your spermatids are, those immature sperm cells. I accidentally said spermatid for a mature sperm cell on that last first slide on the male. I put a little note in my in the title to let you know. So these are immature. They're not quite mature yet, but they're gonna be, sperm. These are the interstitial cells. They used to call them Leydig. Nobody ever calls them that anymore, hardly. But these guys will release testosterone if LH is present. Remember, luteinizing hormone, it does different stuff in the male than it does in the female. So I don't know why, but they tend to make these little triangles. They kind of group together like that. I don't know if that's just a function of when they make the slides or if they're really like that in real life. There's a little artery or arteriole, right? You can see the smooth muscle around it. But I could point at these and go, what are those interstitial cells? What does LH do to them? Makes them release testosterone. What is this structure? You would go, seminiferous tubule. What's being produced? Sperm, right? And then there's, I have something that looks very similar to this. And so there's your corpora cavernosa, there's your corpus spongiosum, and there's your urethra. Okay. And then this is really nice. So this is a mature follicle. Sometimes they're even bigger than this. But that would be your oocyte. That's your antrum, A-N-T-R-U-M. It's just this space. So if I put the pointer all the way across, I'm trying to go, what is that? You go mature follicle or tertiary follicle, whatever floats your boat. What is this? Oocyte. What is this? Space. Antrum. I doubt I would do egg nest and primary and secondary follicles. And we're good. Let's make sure we didn't miss anything. I think we're okay. So the tricky part is here. Well, hold on. So don't forget, mom and baby's blood do not mix. Okay? Only things get across that should get across, right? Nutrients, oxygen going to the baby, waste products, CO2, going across to the mom. Okay. The tricky part was right here, right? So once you get this down, you kind of got it. What spikes at right before day 14? What hormone? LH from the anterior pituitary. That's what makes it, right? Causes ovulation, right? What hormone is stimulating these structures? And you go, oh, follicle stimulating hormone, right? What is this structure? You would go, corpus luteum. What two hormones does that make? You would go, estrogens, progesterone. What phase of the uterus is this? You would go menstrual phase, menses. What phase is this? You would go proliferative. And what phase is this? You would go secretory. Okay, so that's what you got to be careful about. Okay, and then we talk prolactin stimulates milk production of breast milk. All right, I think we're good. All right, so that's part 2. Just remember these are haploid when all said and done. Then once it becomes a zygote by combining with the sperm, then it's diploid. So the sperm is haploid and the egg is haploid. And when they get together, they're diploid. All right, I think we're good. Let's go stop share. And we're going to go in. Okay. And in for off. All righty. Okay.